High blood pressure can cause damage to the body if not easily detected. Hello, welcome to Noble TV Live with Lily Kevin. Today I'm going to tell you something that's very important to your health. High blood pressure. High blood pressure. Some of you call it high BP. We have high BP and we also have low BP. But we're going to talk about high BP, which is generally common amongst people. But first and foremost, what exactly is high BP? High blood pressure, also known as hypertension, is a condition in which the force of blood against the walls of the arteries is consistently too high. It is often referred to as the silent killer because it usually has no symptom until it has caused significant damage to the body. High blood pressure can cause damage to the body if not easily detected. It is a killer disease. It kills very fast, faster than HIV, faster than some other deadly disease you may think of. Now, most people have high blood pressure, but they think, oh, it's just a normal thing. But don't forget that it kills very fast. So you have to tame it. You have to be very watchful of your body. That is why it's very, very important to always go for checkup. Check every part of your body. Check the system. Make sure you're sound. Now, some signs of high blood pressure. I know you might not know some signs or the symptoms of high blood pressure, but I'm going to tell you a few of them now. Number one, headache, constant headache. Some might call it migraine. But when you have this constant blur on your head, it is a symptom of high blood pressure. Now, when you have this headache, some tend to take the pills, which okay, you know the pills you take for relief, but it still persists. At that point, you don't have to self-medicate anymore. You have to go see your doctor to run some tests and be very sure that you are not having high blood pressure. So constant headache is a symptom of high blood pressure. Number two, dizziness. Now, most people, when they get dizzy, they think, oh, I have shortage of blood. I don't have enough blood. Or I've been so stressed. Or I'm feeling sleepy. That's why I am dizzy. But no, sometimes it just doesn't mean that way. It is a symptom of high blood pressure. So when you feel dizzy all the time, when you're supposed to be energetic, you're supposed to be working out, you feel dizzy, it's a clarion call for you to see a doctor and be sure you're not having high blood pressure. Number three, shortness of breath. Every time you're gasping for breath, you have shortage of breath. You don't breathe very well. You feel something is wrong with your lungs. That's another reason to check, to go to your doctor and run some tests to be very sure you're on the safe side. Another is chest pain. Now, most people, when they have chest pain, they tend to think, oh, I have carried too much load. I have done this, I have done that. No, sometimes chest pain is or might not be as a result of too much heavy load you carry, but it might be as a result of high blood pressure. Number five, vision problems, where you don't see clearly. Your vision is blurred. You need to go see your doctor. It's another symptom of high blood pressure. Another symptom is fatigue. When you have that also, you need to go see your doctor. Another one, irregular heartbeat. The beat is not beating the normal rate. Normally, your heartbeat is supposed to be at a normal rate, but you see it's not normal. It's irregular. You have to see your doctor because that is a symptom. Blood in the urine. That's another symptom. And when you pass urine and you discover some particles of blood, it's a clarion call. You need to check it. You need to really, really check it. It's not a normal thing. Sometimes most people, when they see something, they say, oh, it's normal. It's normal. It's not normal. There's nothing normal when it has to do with blood in your urine. You have to check it out as well. And number nine, pounding in the chest, neck, or ear. It's like someone is beating a drum on your chest, your ear, and also your neck. It is another symptom of high blood pressure. So you need to go check it out. Now, note that it is important to know that many people with high blood pressure may not experience any symptom at all. You see the symptom we just read out? Some persons might not even experience any symptom at all, but they have high blood pressure. That's why it's important to have your blood pressure checked regularly. Always go to the hospital and get your blood pressure checked. You can have the checking device. There's a very tiny device you can use at home to check your blood pressure. If you don't want to go to the hospital, you can do it at home. It's very easy. So you can see a physician, tell the person, or the person should show you how to check your blood pressure even in the confines of your home. Now, especially if you have risk factors such as overweight, having a family history of high blood pressure, or living a sedentary lifestyle, all this you need to check them out. Now, overweight doesn't mean you're eating well. Some persons will say, oh, I'm eating well, I'm enjoying myself. Sometimes it doesn't really have to be that. It is what? High blood pressure. So when you're adding excess weight and you know that, oh, I'm not eating the normal food that should make me add such weight, then you need to go to the hospital and have yourself checked. I'm going to tell you some healthy tips for managing and preventing high blood pressure. 1. Maintain a healthy weight. Being overweight or obese can increase your risk of developing high blood pressure. Losing weight through a healthy diet and regular exercise can help lower your blood pressure. So always exercise the body. It is very, very important. And watch what you eat. You can have light breakfast. You can have kind of heavy lunch and then light dinner. And once it's 6 p.m., please do not take heavy food. You can take something light. You can go on fruits. You can go on vegetables. It will help you a lot. Number 2, eat a healthy diet. A diet that is low in sodium, saturated fats, and cholesterol. This can help reduce your blood pressure. Eating plenty of fruits, like I said earlier, vegetables, whole grains, lean proteins, wheat. These can actually help you to stay on the safe path. Number 3, exercise regularly. Yes, I love exercising. Exercise regularly. Regular physical activity can help lower your blood pressure and improve your overall health. Aim for at least 150 minutes of moderate intensity exercise each week. Now, this is a call for you to always exercise that body every day. The body goes to work. The body moves around. The body needs to exercise. The body needs to rest. When it's time to rest, you rest the body. When it's time to exercise the body, you exercise the body. Mind you, daily routine exercise is very important for the body. Exercise in the morning before you go out. Do some light exercise at night before you go to bed. Even in the confine of your room, there are indoor exercise and there are outdoor exercise. If you're that very busy, if you're too busy, you go to work every day. What about Saturdays? You can do the outdoor exercise, while the weekdays, you can do your indoor exercise. But whichever, always exercise the body. 4, quit smoking. Yes, I know some guys will look at me with one kind of eye. But I'm here. You can get me. Quit smoking. Now, some persons tell you, "Oh, I'm smoking this. It's herb. It's grass. It's medicinal." Nothing is medicinal when you inhale that thing into your lung and you puff out. So, quit smoking. Smoking can damage your blood vessels and increase your risk of developing high blood pressure. Quitting smoking can help reduce your blood pressure and improve your overall health. So please, I beg you today to quit smoking. I know once you're addicted to something, it's not easy to get rid of it. But gradually, putting the right steps together, you will get over it. So please, quit smoking. 5, reduce stress. Don't stress the body. No, you are not a machine, neither are you a robot. Chronic stress can contribute to high blood pressure. Finding ways to reduce stress, such as through meditation, deep breathing, or yoga, can help lower your blood pressure. Sometimes you just do the yoga thing. You sit on the floor, you cross your leg, you just meditate. It helps you relax your mind. It helps you relax every part of your body. Try it and you thank me later. Number 6, limit alcohol intake. Very important. Limit it. Drinking too much alcohol can raise your blood pressure. Men and women should limit their alcohol intake to no more than 2 drinks per day. And women also, you should limit your intake to not more than 1 drink per day. Yes, because women, we are the lighter vessel. The men have some kind of, they have this thick skin, so they can always make do with two. But ladies, please stick to one if you must take alcohol. But if you know you mustn't take alcohol, then please desist from it entirely. Number 7, take medication as prescribed. If you've been given a medication by your physician to lower your blood pressure, it is very important to take it as directed by your healthcare provider. Skipping doses or stopping medication without consulting your provider can cause your blood pressure to rise again. So if you have a drug, a medicine, a medication to help reduce your blood pressure, please adhere strictly to it. And if for any reason you have to stop it, then you have to see your physician and lay a complaint. And also, do not self-medicate. Don't self-medicate because you know this drug is for headache and this drug is for stomach pain. When you have headache, you throw it in. When you have stomach pain, you gulp it in. It is a no-no. Always see your physician, run some tests, and be very sure of the right drugs you take. Now, all this should help us to cut down the high blood pressure if you actually have it, to help you cut it down, to help you stay safe, help you stay alive. Thank you so much. Please do not forget to subscribe, like, and share. And also, drop your comments in that section beneath. Noble TV Live. I am Lily Kevin.